Precautions like the use of masks and social distancing continues. Still, some people fear going out and seeking medical attention. Rudy Mireles joins us with a message from a doctor.
As emergency orders mandating social distancing and other recommendations from the CDC hit the valley, doctors felt comfortable their emergency room beds wouldn't be bombarded with patients. But for some residents, the fear of contracting coronavirus from exposure in a hospital setting has kept them from getting the care they need.
One individual ended up waiting a week. By the time they went in, his gallbladder appendix had burst, and he was in severe exposure for septic shock and obviously in fear for his life.
Starting his emergency medicine career 44 years ago in Chicago during the HIV scare, Dr. Edward Mason has seen similar panic. He's also seen what can happen if people don't show up to an ER out of fear.
It's like a snowball coming down a mountain. When it first starts, it's a little thing, you can stop it real easy. But if you let that thing roll for a while, it's getting big and it's building up momentum, and it's going to be difficult or maybe impossible to stop. And that's what's happening to some of these patients.
His team has set up procedures to put worried minds at ease. When a patient shows up to the ER, they are immediately screened at the front door. Temperature taken, questions asked, to make sure they're not at risk. For patients who show no symptoms of COVID-19, there's a mobile facility. From stroke to broken bones, the COVID-free area helps treat those patients. For those with symptoms, the hospital has a separate tent. Critical care needs can be treated right away without exposing others. Inside the emergency room, different sectors are kept isolated. Staff don and remove PPE to keep patients and themselves safe as they enter and leave different areas. As attending physician for the emergency department, Dr. Mason says his priority is the safety of his staff and the patients.
We take care of ourselves, we protect ourselves, but we take care of the patients. And, you're going to be protected. You're going to be screened and you're going to be protected.
Dr. Mason added he hopes these measures will encourage people to seek the care they need. In Brownsville, Rudy Mireles, Channel 5 News at 6.